Thank you very much, Olena. We're going to focus on eye health this morning. In our Ask the Specialist segment, we welcome in ophthalmologist Rupa Wong, Dr. Wong from the Queens Medical Center. Thank you so much for joining us this morning.
Thanks so much for having me.
Let me ask you first off, we're talking children and adults. At what age should kids visit an eye doctor?
Kids can have an eye exam as young as newborns. So I see a lot of times parents will think something is wrong with the child, but they think they can't read the eye chart, so that no point bringing them to see the pediatric ophthalmologist, and that's not true. We can do an eye exam and figure out if there are problems, if they need glasses, if there's something more serious going on, cataracts or lazy eye. But the American Academy of Pediatrics and the Academy of Pediatric Ophthalmologists all recommend all children should have their vision screened by age 4. And unfortunately, only about a third of kids have this done, so we're missing a lot of children.
Are there signs that parents could look for with children that might sort of clue them in to take them to the doctor?
Absolutely. Children aren't going to tell you that their vision is blurry, unlike adults. So you're going to look for sometimes just poor school performance because kids can't see the blackboard. They may be getting headaches, a lot of squinting. Some kids will wink one eye in bright sunlight, double vision. Even some children will have these funny little head tilts when they're watching TV. The parents will come in and say, oh, he kind of tilts his head like that, or he turns his head like that, and that can be a sign of something going on.
Are teachers, I would imagine, a valuable asset in this, because they might be the ones who notice for parents?
Absolutely. I get a lot of kids that come in and the parents say, we didn't notice anything, and the pediatrician didn't really notice anything, but the teacher says that, that the child seems to be having difficulty, squinting a lot, or kind of does some funny things during the classroom settings. So, yeah.
Personally, I've got a 7-year-old and a 6-year-old, and the 7-year-old has visited an eye doctor. How challenging is it with a child, because they don't necessarily, like you said, they're not as good at communicating things, so how do you perform a correct eye exam on a child?
Well, I think that's part of the reason that it's good to go to a pediatric ophthalmologist, because most eye doctors will see children, but they may not necessarily love it. And this is what I want to do for the rest of my life, so we're trained to do it. But there are all these, I have DVDs, all I do is play movies, so the kids really enjoy coming to see me. I can do a lot of the exam while they're watching TV. I have a computerized system, so I can do letters, numbers, shapes, single, in a line, all different ways to get at the information I need to get at.
Well, doctor, can you stay around and answer a few more questions a little bit later?
Great,
Thanks for starting your morning with us.
We welcome back ophthalmologist Rupa Wong from the Queens Medical Center to continue our discussion about healthy vision for adults and for our Kiki. Good morning.
Good morning.
Thanks for being here with us this morning.
Thank you so much.
So let's talk a little bit about glaucoma, and it's my understanding that both adults and Kiki can get glaucoma. First off, what is glaucoma?
So glaucoma is when there's damage to the optic nerve of your eye, and that's the part of the eye that lets you see. Usually it's caused by high pressure in the eye. For Kiki, it's really pretty rare. For adults, it's actually quite common, and that's one of the reasons we really want to make sure that adults come in and get their eyes examined, even if they don't think that they have any problems with their vision, because usually it's completely silent, and people don't notice that they are losing vision because they lose the vision in the periphery first. So it's important that you go for your annual dilated eye examinations, and the ophthalmologist can catch it early.
How does it come about? I know you said the pressure, but...
They're still investigating. A lot of it can be genetic. Sometimes there can be certain reasons to have glaucoma, like trauma, but a lot of times it's just for no particular reason at all, which is why you may not realize that you have it.
Okay, so talk a little bit about Keiki, and if there's any indication that your child has a lazy eye, is that something you should be concerned about?
Absolutely. Especially any children younger than 10, their brain is still developing their visual system. So it's really important, if it's a lazy eye, if it's even just something as simple as glasses, that you treat as early as you can. So for lazy eye, sometimes you do glasses, sometimes you need to do surgery for it. There might be an underlying reason that that child has a lazy eye that wanders. They may have a cataract, or they may have a scar in the retina. Anything that we can diagnose, if we start treatment earlier with kids, the better the outcome.
Now, jokes aside, there is something called a wandering eye.
Yep.
Can you tell us about that?
So wandering eye is when the eye is misaligned. So a lot of people will also call it lazy eye.
Okay.
Lazy eye for ophthalmologists refers to when the vision is actually down in the eye. But a wandering eye is when the eye starts to drift out. So you may know people, they may have poor vision in one eye, or they may have excellent 20/20 vision and the eye just kind of drifts out to one side. And there is surgery for that. That's actually my specialty. People think it's a cosmetic surgery, but it's not. Insurance pays for it to align the eyes because it really affects your social interactions with others.
Would that be the same as eyes that begin crossing or crossing?
Yeah, it's basically, it's a very similar condition. It's just the opposite. So the surgery is almost basically the opposite, where we adjust the eye muscles of the eye and move them accordingly.
Well, Dr. Wong, do you guys have any upcoming events or anything that people could get more information? Or
we're routinely always having events, so if people check out our website at honolulueyeclinic.com, they can check out and see us on Facebook as well.
All right, thank you, Dr. Wong,
Thank you.
and for being with us bright and early on this beautiful Monday.
Thank you.
All right, well, we will have much more right here on Wake Up Today. Take a quick time out, have top headlines for you.